here again, and I'm a medical oncologist who specializes in prostate cancer. And this is part 4 of a video series on decision-making in advanced prostate cancer. I'm here with Fred, whom you all know by now. Fred, what are we going to discuss in this video?
Today we're going to discuss options regarding my treatments or your treatments. What options you have in terms of when to start it, when to stop it, what to take, what not to take, all that.
Yeah, and specifically this one is going to focus on one of 2 options that we talked about before. Option 1 had been starting a hormone treatment consisting of Eligard and abiraterone at a later time, which has turned out to be something you just started recently.
Correct.
And option 2 was starting it before.
Much earlier, yeah.
Much earlier. So yeah, let's talk about option 1, which was waiting a while and starting this treatment at a later date, and just tell me about that process.
All right. Well, the process was pretty simple. The motivating factor of all of this was the knowledge that these drugs carry some pretty severe side effects. And through my research and stuff, I got pretty worked up about or frightened about the side effects. So I, like a lot of people, put it off as long as I possibly could. Among many possible side effects is the loss of libido, and that to a person like me was a hard pill to swallow. The idea of not being interested in sex or women in general. I mean, I'm happily married, but that really weighed on me more than any of the other side effects. I mean, because even now I can't believe that that's true. But having said that, because of the support group I'm in, one of the things that helped me to make my decision was my support group. And I talked to all those guys, and they said you might get some of the side effects, you may not get some of them. Some never had a loss of libido. Others, most did. And of all the side effects, that seemed to be the most common one. And yet at the same time, it's the hardest for me to believe is possible. So that was my big concern. The other things, gaining weight, there's some redistribution of your weight, losing muscle mass and strength are obviously very important too. And those are side effects that can occur. So I just decided to stop being afraid and just get going. Get on with it, because the ultimate goal is to is live a quality life as long as I possibly can. So I'm all for treatment. And now that I've embraced it, I'm ready to go.
Yeah, thanks. And again, many things to talk about, but you mentioned some really important side effects of Eligard, Lupron, etc. Loss of libido is very common. It doesn't happen to everybody, but it can be a very serious life-altering side effect for many men. You can just imagine you've lived with a certain amount of testosterone your whole life, and now we're taking it down to almost 0. That's going to result in some changes. Loss of muscle mass, you mentioned, fatigue. I'll mention a few others like fatigue, hot flashes, gynecomastia, which is some breast tissue enlarging, gaining weight around the belly, irritability, emotional lability, so getting just a bit more emotional.
Right.
And not everybody has these things. I tell people that surprisingly, maybe about a quarter or a third of patients don't have any of these side effects. A third of people have them really bad. And then a third of people are somewhere in the middle where they notice them, but it doesn't bother them. And unfortunately, can't really predict what each person individual is going to experience.
Yeah. The other thing is hot flashes. If you've never experienced a hot flash, it's a pretty unusual feeling. And in fact, I had one just the other night. So that's really the first effect I've seen of this.
Yeah. What did that feel like for you?
Well, it happened while I was sleeping. And I just remember waking up and my t-shirt was soaked, and I was like, I think because it happened when I wasn't conscious, it was probably an easier thing to go through. I'd probably be pretty alarmed if it just happened when I was sitting here. But, I know that can happen, so. But that's the only thing I've noticed so far. But of course, I'm totally hypersensitive now, And keep asking the guys, how long does it take for this to kick in? And then some guys say, 2 weeks. Sometimes it takes a month, you know. And so anyway,
Yeah. And how long has it been since when was your first shot?
The 15th of March. So what,
About
2.5 weeks ago, 3 weeks ago?
Yeah, something like that. Okay, great. So yeah, that's the Eligard, and then the abiraterone, because it also involves lowering testosterone. It can intensify some of the side effects we just talked about. You also need some lab monitoring because it can affect your potassium and your liver tests. You need to monitor your blood pressure because that can go up. But you know, it doesn't really have too many serious side effects. Oh, one more thing is that there's a very, very small chance of having some cardiovascular issues like palpitations and stuff. But most people don't have that.
Yeah, that's an interesting concept, because you're right. I mean, I'm almost 70 years old, and I've run with a full tank of testosterone my whole life. So it's going to be an interesting experience for me, you know. So we'll see.
Definitely. And I also wanted to comment on, you know, we framed this in terms of options, and you know, option one was waiting. And so just kind of like from my perspective, correct me if I'm wrong, it seems like the benefit of this option of waiting would be that you're delaying and avoiding all these potential side effects of treatment, like loss of libido and the hot flashes that you've had. And you got a year or 2 years of being treatment free, of enjoying your life, having full libido, full energy and all that. And then if we also look at the question of then what was the risk of waiting, from an oncologist perspective, the risk would be that the cancer grows and grows and grows really quickly. And perhaps there's a small chance that it grows so quickly and suddenly you have a complication that arises regardless of what the PSA is doing, like a new spot in the bone. And maybe that wouldn't have happened if you started earlier. It doesn't sound like something, some complication like that has happened to you. So I'm really happy about that.
Well, I think one of my questions really is why was I told at the beginning, well, you should start the hormone therapy now, when it was clearly so low? And it really, well, it wasn't, you know, in all fairness, it's when it doubled that everybody started waking up. That's when we decided to start all this again. So yeah, he gave me a couple of years of freedom, you know, and feeling good. And I'm not suggesting I'm going to feel bad necessarily. You know, there are side effects, and they do affect. So we'll just deal with them as they come. You know?
Yeah, and that's totally fine that you are looking back and with some hindsight and saying, you know, I wish I knew or asked, you know, why do we have to start now when my PSA is so low? And I hope our viewers sort of take that as a lesson to not be afraid to really ask these hard questions. And it might feel like you're challenging the doctor, but I think at least for myself, when I see a patient like that and who asks that question, I'm really happy that they're engaged and are curious and really want what's best for them. And so I'm happy to answer that.
Yeah, well, it was interesting because my doctor wanted to start me on it right away, and then I consulted with another doctor, got another second opinion, and he said, and he's the first one that ever said, listen, we don't really even start hormone therapy usually until your PSA is about 5, you know, unless it starts doubling rapidly. And the first time, I guess it hadn't doubled so quickly the first time, and the doctor said, look, if your doubling time's like every 12 months, you know, you'll be fine for a while, you know. But my doubling time turned out to be much more rapid. So, you know, we all had to kind of rethink things.
Yeah, understood.
Yeah.
So. Great. I think that's it. Great talking to you again, Fred.
Great.